Lucy Letby, serial killer or scapegoat? Hello cruel world, I'm Dr Sohom, consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Today we're diving into a case that's shaken the medical community to its core. Lucy Letby, a neonatal nurse, was convicted of murdering 7 babies and attempting to murder 6 others. In this video, we're going to take a closer look at the psychological evidence in the Letby case. We'll examine her diary entries in full, exploring the complex emotions they reveal. We'll highlight the expert doubts. Some experts are calling this evidence implausible. Is this a massive miscarriage of justice? I'll also answer the question, what is survivor's guilt? And also, what are the psychological factors associated with it? I am evil, I did this. These words were scrawled in Lucy Letby's diary and they seem to seal her fate. But what if I told you that these words, when taken out of context, might not mean what you think? In my opinion, it's feasible that they were the desperate scribblings of a nurse grappling with guilt over babies she couldn't save. The Countess of Chester Hospital Neonatal Unit is a place where tiny lives hang in the balance every day. But it's also chronically understaffed, with nurses and doctors stretched to their limits. And back in 2015, the hospital noticed something alarming. There was a spike in infant deaths that couldn't be explained. So naturally, they called in experts, and instead of finding a clear cause, they found Lucy Letby. So you know what they say, correlation doesn't equal causation. Just because we're seeing more people wearing hats doesn't mean hats cause winter. And just because I'm crying and some of you hasn't subscribed yet, doesn't mean I'm upset at you. But in a courtroom, sometimes it's hard to tell the difference between correlation and causation. And the prosecution built a case that seemed airtight. So you're on the jury and the prosecution, they wheel out this chart and every suspicious death leads to a shift that Lucy Letby is on. So that's pretty damning evidence, isn't it? And then they pile on more evidence. They look at her notes and the statistical anomaly of so many deaths on her shift. But I'm asking the question, is being in the wrong place at the wrong time really proof of murder? The prosecution claimed Letby used a macabre range of attacks, injecting air into babies, overfeeding them with milk, and even poisoning them with insulin. The courtroom was heavy with grief. There were parents who lost their babies, and there were also Letby's colleagues who were just in shock. And the prosecution painted a picture of horror, healthy infants dying inexplicably, leaving the medical community baffled. It's the kind of testimony that hits you in the gut. But some experts are debunking these theories. They're calling the idea of injecting air through nasogastric tubes nonsensical and ridiculous. And those insulin poisoning claims, based on tests that some experts are saying are not reliable, they're calling the medical evidence implausible and medically inaccurate. Some even suggest it doesn't meet the standard of proof that is beyond reasonable doubt. So that's the standard you need for murder. So let's start with that air embolism theory. Dr. Evans, the prosecution's star witness, claimed that air was injected into babies even through their feeding tubes or directly into their veins. But some clinicians argue that it would be practically impossible to inject enough air without it leaking or being expelled by the baby. In fact, 8 separate expert clinicians have gone as far as calling this theory rubbish and fantastical. Dr. Xu Li, a retired neonatologist, pointed out that the skin discoloration described by the prosecution doesn't even match what you typically see with an air embolism. Now let's talk about that insulin poisoning evidence. So it turns out that those tests might not be as conclusive as we were led to believe. Professor Alan Wayne Jones, a leading toxicologist, has criticized the use of immunoassay tests in criminal convictions. He argues that these tests need to be verified by more specific analytical methods to provide binding evidence. And he's not alone. A whole group of experts submitted papers to the courts of appeal arguing that the test results were fundamentally flawed. So if these key pieces of evidence are shaky, well, what does that mean for the whole case? Well, some experts, like Dr. Silvana Dimitrova, believe that the medical evidence alone isn't enough to prove Letby's guilt beyond a reasonable doubt. She even went as far to say that the prosecution's case was full of medical inaccuracies. So, if the medical evidence is questionable, why was Letby convicted? There are still some reasons why people believe that she might be guilty. So the statistical anomaly of so many deaths on her shifts, obviously that's hard to ignore. And her presence at every suspicious death would raise even the heaviest eyebrows. So let's examine Letby's diary and her behaviour. Is this actually revealing the psychology of her guilt, or could there be just random scribblings that are not a confession? I am evil, I did this. Those words from Lucy Letby's diary seem pretty damning, but I think there's more to the story that meets the eye. So during and after the deaths, Letby's actions seemed suspicious, at least on first glance. She kept detailed notes, she had strong reactions to the death, and she even made memory boxes for the grieving parents. On the surface, it might be the behaviour of someone with a guilty conscience, but as a forensic psychiatrist, I've learned that things are rarely as simple as they seem. And working in a high-stress neonatal unit is no saunter in the jungle. Imagine being surrounded by tiny, fragile lives every day, knowing that despite your best efforts, some of the babies just won't make it. It's the kind of environment that can mess with your head in ways that you might not expect. Guilt and trauma have a funny way of manifesting themselves. So those diary entries which seem so incriminating, they might not have meant what you think. Letby also wrote things like, kill myself right now, hate my life, fear, panic, despair, why me? I haven't done anything wrong. So this might paint the picture of somebody in extreme distress and not necessarily a cold-blooded killer. Some experts are actually starting to think along these lines. They're suggesting that Letby's actions could be consistent with survivor's guilt or PTSD, that's post-traumatic stress disorder. So here are some of the psychological factors that contribute to survivor's guilt. So firstly, there's cognitive dissonance. So this is the mental discomfort experienced when holding two contradictory beliefs simultaneously. In the case of survivor's guilt, the survivor may feel fortunate to have survived, but they also believe they don't deserve that good fortune, leading to internal conflict. On top of that, there's a sense of responsibility. Some survivors may wrongly believe that they haven't prevented the tragedy or that they should have done more to save others. This misplaced sense of responsibility can lead to intensify feelings of guilt, even if logically they know they're not to blame. During the trial, Letby's behaviour raised more questions. She cried on cue for her barrister, but she appeared belligerent when cross-examined. So the prosecution painted this as emotional manipulation. But in my opinion, this could be the sign of the deeper psychological distress of somebody who's actually innocent, but feels like they're not being believed. So the prosecution tried to fit Letby into the mould of a typical serial killer, somebody who derived pleasure from her actions. But many experts say this doesn't align with the evidence. There was no apparent motive. There was no psychological background that matched the profile. So if the medical evidence is questionable, and if Letby's behaviour can be explained by trauma, how did we end up here? System failure in healthcare is not a sexy topic. It's less salubrious and maybe less satisfying than having one bad apple that we can blame. But it's crucial. We have a hospital that's so stretched, so under-resourced that it creates the perfect storm for tragedy. And in fact, a review by the Royal College of Paediatrics and Child Health in July 2016 found that the neonatal unit at the Countess of Chester Hospital was critically understaffed. Consultants were trying to cover both the paediatric ward and the neonatal unit, and this led to inadequate care for those tiny, vulnerable babies. But it actually gets worse than this. So junior staff often felt they couldn't call in consultants for help, and then the middle grade doctors lacked the experience to handle complex cases, and they were left in charge. It's like asking an American tourist for directions in London. After the spike in deaths, the hospital management downgraded the neonatal unit. And guess what? The number of deaths decreased. It's almost like the unit was operating beyond its capabilities and putting these babies at risk. So what if focusing on Letby has allowed these real issues to go unaddressed? Dr. John Ashton, a former public health director, hit the nail on the head. He said, and I quote, "You don't need a serial killer to account for what happened in Chester. We're talking in Chester about system failure. It was a hospital that was not well run, that had ambitions beyond its capability, that had problems with clinical governance and environmental problems." Now, it's human nature to want a clear villain, someone to point the finger at. But what if in our rush to find a culprit, we've missed the outback for the bushes. Letby's request to appeal her original murder convictions was denied in May, and she was separately convicted in July in a retrial of 1 count of attempted murder, and that appeal was rejected too. So the appeal court judges rejected Letby's arguments that the expert prosecution evidence was flawed. That tells us that there was still no consensus on the validity of the evidence used against her. So where do we go from here? Well, it's time to talk about the bigger picture. Dr. Sylvanie Dimitrova, an NHS consultant neonatologist, hit the nail on the head when she said, "There are fundamental flaws in the justice system when it comes to prosecuting healthcare professionals, which meant that it does not address systemic NHS failures and blames individuals instead." So this case has implications far beyond Lucy Letby. To me, it's shining a spotlight on how we handle complex medical cases in court. So what changes need to happen to ensure justice and patient safety? There's no point talking about the problems if we don't offer solutions. Well, for starters, we need to have better oversight and accountability in our healthcare systems. We need to address those system failures that put patients at risk in the first place. And in the courtroom, we need to make sure we're using solid, scientifically sound evidence. Okay, I know you're very busy and very important, so let's summarize what we've learned today, kids. As we wrap up this deep dive into the Lucy Letby case, one thing is crystal clear. This isn't about 1 nurse or 7 babies. It's a wake-up call for how we handle complex medical cases and systemic failures. We've seen how easy it is to point fingers, but the truth is often messier than we'd like to admit. So remember, guys and girls, in the world of forensic psychiatry and also in life in general, things are rarely as simple as they first appear. It's on us to question our assumptions and look beyond easy answers, especially when lives are at stake. Okay, so let's finish by summarizing the main points of this case. We've got questionable medical evidence, those air embolism theories that experts are calling nonsensical, and we've got deeply emotional case for the jury and a courtroom which may have clouded their reasoning. We've got Letby's behaviour which could be explained by trauma rather than guilt, and we've got these systemic issues in the hospital that created a perfect storm for tragedy. So next time you hear about a high-profile case like this, ask questions, think critically, and always consider the bigger picture. I urge you to subscribe to this channel. Not only does it help me out immeasurably, but it will instantly cure your partner's horrible, heavy snoring, guaranteed all your money back. See you next time.